Okay, we are ready to wrap up our Essentials presentation for you here in the studio. The way that we like to do this is basically to end with what we call a kind of a modified Monday morning protocol. In other words, where do you start with this information? We have people coming into the Z-Health curriculum from all over the world and also from a multitude of professions. This makes it awesome because we have truly one of the coolest communities of professionals you will ever run into. I have always loved the fact that in a class I may have 4 doctors, 15 physical therapists or physios, 20 coaches, trainers, personal trainers, an acupuncturist, etc., and they're all getting to see what the other person does. We have seen more integrated practices occur, I think, out of our courses than anything. And it's awesome because it also helps build a community that says, I'm an expert in this, I'm not an expert in that, I want to learn about that, but in the meantime, I may need to make some referrals. So the challenge within that as a curriculum designer is, how do I help the greatest number of people going through this curriculum get started? Because what will prevent you from becoming an expert, not just in Z-Health and applied neuroscience, but in anything, is a fear of initiating the practice. Right? Very simple. We all know that. A lot of people that come into the curriculum feel like, hey, I need to watch this class 17 times and to get started. That's actually not true. If you keep some of the basic principles in mind and just remember that your goal is to help people leave the training session or leave a therapy session feeling better than when they walked in, and you combine what you're learning here with what you already know, you should be able to begin immediately. But we like to give you, again, some ideas. So whenever we first start talking about this idea of where do I start, I want you to begin with a reminder. The reminder is that every athlete needs to breathe well, see well, balance well, and move well. What did we work on in this most basic intro course? Did we do some breathing? Yes. We did arrhythmic excursion testing. After we did that, we did some thoracic mobilization, some motor control exercises in specific positions. We then added in diaphragm stretch, diaphragm 1 and 2. So you already have some initial tools, again, to combine with what you already know. See well. Obviously, we just finished our integrated vision section. We spent a lot of time on vision. Balance well. We spent about an hour going through a very specific balance training protocol and also introduced you to the vestibular system. And finally, move well. We went through a lot of material about the proprioceptive system, hopefully encouraging you to think about it more neurologically. The key takeaway, I think, from all of this is that breathe well, see well, balance well, and move well must be individualized. I cannot say, teach everyone these 4 breathing exercises, these 7 vision exercises, these 8 balance exercises, and these 160 motor control drills. It doesn't work that way. We've tried to demonstrate over and over that the key concept is the minimal effective dose in the individualization or personalization of a training program for the person standing in front of you. So if you start initiating Z-Health work with your clients, keeping these concepts in mind, we then want to have a way to target or maybe guide the exercises and whatnot we're going to try. And the easiest way to do that is to take a fantastic history. You need to know the person standing in front of you. There's a famous quote in medicine that says, it's much more important to know the type of person that has a disease than the type of disease a person has, right? Meaning that the individual is more important than the condition. So when we talk about knowing where to start, we recommend that you take a great history. Great history, usually for me, if I'm working with a new client, will take 20 to 30 minutes. I want to know about everything that's happened to you. Have you had, injuries, surgeries? Do you have scars? Do you have tattoos? Have you had head injuries? Have you had a lot of dental work done? Because usually somewhere in the history, there's going to be a major injury that probably, or maybe even a minor injury, but an area of the body that was probably never rehabbed. Remember that rehabilitation should include sensory rehabilitation, sensory before motor. So if you've never asked your clients about all the different things that have happened to them, you need to do that. Have a picture of a person and go, just have them circle where they've had things occur. In that, you can then ask them, did you rehab that area? What type of rehabilitation have you done? If they said, I just let it heal on its own, or I did some kind of traditional work with this particular person and it was mainly exercises and some hot cold, you already have a great starting point. Remember areas in history or areas in an individual's history that may have never been appropriately rehabbed. probably are indicating to you that there are mapping issues for them in the brain regarding that area of the body. On top of that, you obviously want to ask them about vision problems. You want to know about glasses, know how their eyes function at the beginning of the day and the end of the day. Ask them, are there certain things that you avoid doing with your eyes? And then you're going to ask the same question about balance. The whole time you're talking to them, you're watching them breathe. Are they breathing really fast? Do they have a shallow breathing pattern? So maybe they're chronically hyperventilated. So the history taking is incredibly powerful in data collection, but also in observation, okay? So when you are beginning to evaluate someone, you're saying, these are the things you need to be able to do. I'm going to talk to you, listen to you for real, find out who you are, what's happened to you, and I'm going to be watching you throughout that process. So observation of movement, observation of speech patterns can also give you a tremendous amount of information about what they're in need of. In our phase, which is the level 1 course in our curriculum, we will spend a tremendous amount of time talking about gait analysis, gait observation, because watching people walk, just how they move through the world naturally, will give you tremendous insight into what's going on with the brain. It's a great window into neurologic function. But for right now, until you've gotten through that course, watch your clients based on the things we've already been talking about. When you ask them to maybe turn or move in the gym, do they do it carefully? Do you see signs of startle as you're asking them to maybe do a proprioceptive drill? Are you watching their breathing as they're going through a training session? Are there periods where their breathing looks so labored that they start to look like they're under threat? All of that can again give you information about which exercises and which tests to run and which exercises to assign. Finally, this is the only part of this class where I'm going to talk about this. I'm going to highly recommend that if you like this material, you've fallen in love with this idea of applied neuroscience, please don't stop at essentials. We have a multi-100-hour curriculum, and trust me, it's not because I want to teach a multi-100-hour curriculum. It's because neurology and the human body are complex. And I've spent almost 3 decades trying to take what cost me, literally at this point, millions of dollars in education and condense it down into something that is practical and usable immediately for anyone that has some background in movement science. So if you, again, find yourself getting into this, starting to work with clients, finding issues, and not knowing where to go based off this course, that's understandable. There is more information to be had. So we always recommend that if you're finding that this, has, again, stoked an interest in you, then make sure you contact your ed advisor, talk to the office, because we can always help you figure out for your profession, for what you do and what your goals are, what's maybe the most appropriate path through the curriculum for you. All right. Now, one of the last things that I want to discuss here is just the idea of, once I found a problem with a client, how do I talk to them about what I want them to do? So remember that whenever we are giving out drills in the Essentials course, as the coach, you will, for yourself, not for the client, but for yourself, you will categorize them as either rehab drills or high performance drills. The definition of these should be pretty evident. A rehab drill is something that your client has failed at, that they need to be able to do, but on reassessment from that kind of MED perspective, it does not give them a great result. We saw multiple examples of that between Tony and Micah over the course of the video shoot, where maybe it was a smooth pursuit to the right, or smooth pursuit up and right, or specific balance position, where the resulting test, the reassessment, wasn't great. Remember, I said at some point that if I have someone do a smooth pursuit to the right and their reassessment is not very good, I don't then give them permission to never look to the right. That is something they need to be able to do to survive in the real world. We can't have that degrading movement. That is going to be a rehab drill in your head. And in terms of assigning them homework, the first thing you will decide is, do I need to regress it? So do I need to change the distance? Do I need to change the speed? You go back and look at the dosing slide that we provided for smooth pursuits. That would give you some information about what can I change. So I regress it, hopefully to get a better result from them. At a bare minimum, I don't want it to increase like if they're having pain, I certainly don't want the drill to increase pain for them, so I will regress it. If you have a lot of rehab drills that you're finding with a given individual, don't ask them to do everything because it will be exhausting. Remember, there's a fuel deficit in many of these cases. So when I have rehab drills for people, I usually will only give them 1 or 2. We ask them to do 1 or 2 repetitions of that skill per hour. Almost all of them will not do that, not because they don't like you or because they want to maintain their problem, but because they forget. So if you assign homework to someone, you must also tell them to build a reminder system into their day, or you must function as a reminder system, sending them a text every hour or 2 saying, hey, did you do your exercise? This is just human behavior. This is not anything vindictive on their part. Most of the time, it's just they forget because life is busy. So if you're going to assign 1 to 2 reps per hour, you have to talk to them about building mental reminders into their daily plan. Now, the goal here is that they need to do these drills at least an hour or more from any time they need to perform maximally. Now that may be max performance physically, meaning they're going to go out and play a sport, they're going to go to the gym and get their training session in. It may mean that, hey, I have a big meeting coming up, I'm speaking at, I'm presenting. In any of those situations, please don't have them burn up a lot of fuel with something that's really challenging to their nervous system because that is not good for them in the long run. So keep it at least an hour away from max performance and keep the reps really low. In general, what you will see is if they are actually doing more of these repetitions and their brain is starting to go through some plastic change, they may need more fuel. So you may want to incorporate some additional breathing exercises or talk to them about their food and diet as you go forward. Now, for high performance drills, obviously the goal that we've said throughout is to take people who are negative responders or non-responders and turn them into super responders. So a lot of what we're doing is looking for drills that make people perform better. We're going to call those high performance drills. What we're going to do with these is if we're seeing great benefit, we're not going to stop at 1 or 2. We're going to give you 3 or 4 to do every single day. Normally, we're not going to have you do them every hour. We're going to actually have you do them 1 to 3 times per day. I always ask for 3, expecting to get 1. Once again, you have to have a reminder system in place, otherwise people won't do them. I typically, once people have learned them and they know that their body responds well to them, we will make sure to include those high performance drills as a part of their warm-up for other training sessions or other events. So even if I'm not with them and I say, hey, what are you going to do on the off day? I'm going running or I'm going hiking tomorrow. Great, when you get to the trailhead, take 5 minutes and go through your high performance drills. It'll set you up to be more successful on the hike. We also would teach them to use as a reset drill. What does that mean? It means that if I have them doing a rehab drill as well that makes them feel terrible, or they're out, doing something in the yard and they start to get some kind of nagging issue that's cropping up, we will tell them, do your high performance drills to basically help. We use the word reset. The nervous system doesn't have a reset button, but basically we can use this as a threat modulation tool so that maybe the brain will not feel so convinced that it needs to enact some kind of protective response. All right? What we often will see is that after 1 to 2 weeks of rehab drills, those rehab drills might start shifting over to high performance drills, right? The goal is to take something you're not good at, make you good at it, and make you so good at it that eventually your brain goes, hey, I love that. So ultimately, this is going to be the pattern that we're searching for. It does not always work exactly like that because there may be some interfering factors, but this, from an essentials level, is a fantastic way to think about the exercises and the results that you've seen through all the testing. All right. Now, the last thing that I want to mention, if the PowerPoint will cooperate, is one of the biggest challenges that you'll run into as you get into applied neuroscience and really start to develop expertise is that you're going to get clients coming from all over. People are going to find you because you're going to help one person. Someone's going to come in with a weird back pain or knee pain. You're going to do a vision drill, some vestibular work with them, work on the proprioceptive system, and they're going to feel better than they've ever felt. Maybe they've had it for 20 years. And this will happen. This is just, again, after 25 years of sharing this information and watching people do it, this is just the way things go. Now, what that means is that at some point, someone's going to walk in the door that you are not equipped to handle. You're going to be like, I've never heard of that condition. I don't know what that is, which means that as an ethical professional, you must begin building now, if you do not already have it, a strong referral network. None of us, there's an old saying, none of us are as smart as all of us. So when it comes to helping people with individual conditions, I really recommend, as I said, that you start building a referral network. When you're wondering about who should be in that network, these are some suggestions that we normally make. Number one, especially if you're in Essentials, you want to contact Z-Health trainers who have more training than you do. We have people that have spent literally thousands of hours with this material in our Master Practitioner program, who are literally world-leading experts in multiple areas. Most of them are super helpful and amenable to taking clients from people who are newer to the system and assisting them in figuring out what to do and then helping you do the ongoing training with them. So having another Z-Health trainer, someone to just bounce ideas off of, can be incredibly helpful. If you work in a facility, I can also tell you this, the most successful implementation that we've seen of Z-Health principles around the world usually occurs in facilities where everyone's going through the training together. Because now you have 4 or 5 people, hey, do you see this? Do you see this? What drill did you try? And all of a sudden you're all becoming smarter and more cohesive in your approach together. Obviously, you need medical professionals available in your referral network, a GP, general physician, general practitioner, chiropractic physician, often incredibly helpful. There's some super well-educated chiros out there who also specialize in neurology. There's been some great interactions in between the Z-Health community and those groups. So make sure as you're building your referral network, think about that. Having a great orthopedic surgeon available, because some things you can't drill back together, right? If you have a torn ligament, torn tendon, ACL needs to be repaired, bicep needs to be reattached, you need a great surgeon for that. So make sure that you have that person available. You would think as a general practitioner, maybe in fitness or whatever, that people wouldn't show up to you with really weird things, but occasionally it does happen. Obviously a neurologist or a neurology center where you can make appropriate referrals if you see something really weird or you go, you know what, this is beyond me. I have no idea what's going on. It's certainly okay and advisable to make sure that they're being medically evaluated before you begin doing any of this work with them. In addition to that, we recommend that you find a pain management specialist, a behavioral optometrist, if possible, in your arena or your area. A behavioral optometrist is an optometrist who specializes in appropriate levels of vision training for different ages. Many behavioral optometrists specialize in pediatrics, but there are some really fantastic ones around the country who are absolutely fantastic at helping blend lensing prisms with vision exercises. So there are some great conversations you can have, and they're also a great referral source if you think that someone has vision issues that are well beyond what you can handle. Finally, having great physical therapists, massage therapists available if you don't have hands-on skills yourself are also great to have. Now, you can add other people to this list, particularly depending on what you do, from acupuncture to nutrition, etc. But this is just a starting point, and more than anything, it is here as a reminder that the number one goal is not our business, it's not our bank account, it's not looking cool in front of everyone else. It's actually the health, the safety, the well-being, and the longevity of the person that is entrusting their care to us. So we have a strong, if I will say huge, ethical responsibility to be absolutely the best that we can be as a practitioner and surround ourselves with other amazing practitioners so that we can help people who, again, come to see us with the best possible care. So, guys, I hope that this makes sense to you. I hope that you have absolutely enjoyed this new studio version of Essentials. We've been waiting to do this for a long time, so we're really happy to be here in a new studio with a new look. The material is the same, but hopefully you'll be able to access it much more easily this way through Z-Health University. So we hope that, again, that you've enjoyed it, that you stay in touch with us, and we look forward to continuing on this journey of applied neuroscience with you. We'll see you soon.